There are a number of shifts that we need to make, both within Doccla, across the health and care system, and specifically for the person. How do we move from what we consider episodic, specific, focused elements of activity and care to care models that are more continuous and longitudinal and support people at home, not just when they come to see us? If we're going to move to more continuous, longitudinal, outcomes-based focused on populations, we need to think about how to really incentivize that way of working and build an approach that allows us to focus on the right activities at the right time. How do we, therefore, not just see people when they're in crisis, when they've already deteriorated, but actually shift our operational mindset to focus on the people at an early warning sign of deterioration? What are those things that happen 9 days before somebody goes to hospital? How do we shift both our mindsets, but also our operational processes, our data, our performance metrics, to find the people and the activities that would, 9 days before they show up to hospital, have the greatest impact? Another big operational shift that we need to think about is designing systems around people rather than around providers. What do you need? What matters most to you? And how do we think about building the model from you in your home rather than around us and our point of care? You aren't getting sick just between the hours of 9 and 5. In order to deliver safe care in a proactive way for these patient populations that we're targeting, which are oftentimes those that are multimorbid, complex, and have not one but multiple long-term conditions, we need to think about a series of steps that really enable us to ensure consistency in care, but also recognize the complexity and the requirement for flexibility in the care model. It starts from the very beginning of the process, where we leverage data to really identify those that are at high or rising risk of poor outcomes, hospital admissions. And once we have that segmentation model, we can use risk stratification tools and impactability analyses to really understand the cohorts of a larger population and what their needs are. What are the things that are consistent that can work across everyone? And what are the things that we really should target for sub-cohorts within a population? Before go live, have a really strong process of clinical governance and escalation pathways and protocols. We ensure that there's mutual agreement on when, why, and how we work within the wider care system, and how information is shared between to make sure that those handoffs are seamless for the person. We need to recognize that equality and equity are not the same. That doesn't mean treating everybody the same in order to get scalability, but rather finding what can scale and what can't. We're really focused on getting the right interventions to the right people at the right time, not necessarily treating everybody exactly the same. Data is driving everything we do and nudging people to make the right choices at the right time to manage their conditions.